Now, the difference between an optometrist and an ophthalmologist is often a confusing one to the average person. And this is particularly true when we consider the differences in their roles that exist between countries and often between states to state within the same country. In this video, I'm going to explain what the differences are in their qualifications, the roles they play, and also the places where they work. So keep watching, and hopefully by the end of this video, you'll be crystal clear on the difference between your optometrist from your ophthalmologist. Hey, what's happening? This is Martin's Eye Tips with me, Martin Aguzi. Thank you for joining me. If you are new here, then I'm a UK-based optometrist, and this channel is all about helping people to see better, see more comfortably, and being less anxious about their eyes. So if you are new here, then please think about subscribing to the channel. Hit that notification bell as well if you do, so you get reminded every time I upload a new video. Now today we're going to be talking about the eye care professionals that are involved in helping you to see better. So let's get started. So as an optometrist myself in the United Kingdom, then most of the information in this video is going to be based on a UK perspective, but it's important to know that there are differences from country to country when it comes to eye care and optometry in particular. So where possible, I'm going to refer to some of those differences. Training and qualifications. The training of an optometrist in the United Kingdom usually begins from about the age of 18, after somebody has gone through their advanced level qualifications typically, and they're expected to achieve the high grades in 3 subjects, which are sciences or maths based subjects, and the kind of entry examination requirements would typically be AAB or even straight A's in those subjects. At that point, then the candidate will then go on to study optometry as a degree at one of the universities that offer the program in the United Kingdom. And typically the optometry degree in the United Kingdom is a 3-year Bachelor of Science degree, or it may also be a 4 years master's degree as well. Now this gives you the qualification of an optometrist, but in order to practice in the UK, you'll have to then do a pre-registration year, and this involves working full-time for a year while preparing for professional examinations. And upon completing all of your professional examinations, then you are eligible to be registered and you can practice in the UK. So essentially, to practice as an optometrist in the UK, it's a minimum of 4 or 5 years from starting your degree program. Now, it's important to know that in other countries, the training program for optometrists are often 4 years or more, and often lead to a doctorate of optometry degree, and they then have the title of doctor. This is not the case in the United Kingdom. The training here leads to a Bachelor of Science degree or a master's degree, and we do not have the designated title of doctor here. Now, on the face of it, for what I can see, the training is essentially the same between UK optometrists and our fellow counterparts around the world, although they have a bit more extension in certain areas that allows them to have more, for example, rights to prescribe and treat certain conditions. So that is something that I suspect is likely to change with the expanding roles that's kind of happening in the United Kingdom and more now. Then it's likely that there will probably be a situation where a doctorate degree is then on the offer for optometrists here as well. Now, ophthalmologists, on the other hand, are required to go to university and get a full medical degree, and during their advanced level studies at higher education, you'll be required to achieve grades of AAB in your A levels, or most realistically straight A's, just because of the very competitive nature of the subject. Then upon completing your medical degree and working as a junior doctor, then you'll have to specialize as an ophthalmologist. So ophthalmology is essentially a specialty of medicine. So while some people go off and specialize to become a cardiologist, others may go and specialize in pediatric medicine. Then to become an ophthalmologist requires you to apply for and successfully be accepted onto a program of training to become an ophthalmologist. Having successfully applied and been accepted onto the program to train as an ophthalmologist, the successful candidates will then have to embark upon a roughly 7-year training at least to become a fully fledged ophthalmologist. So you can think of it almost as, having completed your medical degree, you now have to do an optometry degree, as well as surgical training, and as well as perhaps some extra medical prescribing training for ocular conditions. And at this point then they are eligible to become registered with their governing bodies. They'll already be registered with the General Medical Council as doctors, but then they'll need to be registered with the Royal College of Ophthalmologists, as well as the Royal College of Surgeons as well. Now, ophthalmologists will obviously have the qualification of doctor and the title of doctor, but this will be an MD in recognition of the fact that they are medical doctors. Now, just a little tip to think about for those of you who are thinking about a career in ophthalmology or even optometry, then the reality is optometry school is a little bit easier to get into, but that's not necessarily because of the grades. The grade requirements are very, very similar between the two subjects. And in fact, many of the people you'll find on the optometry degree program already have the grades to do medicine. But the reality is that medicine is just a very competitive program. So if you're somebody who finds yourself missing out on medicine and you decide to do optometry, but you still have your heart set on becoming an ophthalmologist, then you may well find that actually completing your optometry program and then applying to medical school may be actually a faster route to become an ophthalmologist. You may well find you're able to cut a few years off the number of steps that it takes to get there, just because as a fully qualified optometrist, then you will usually be able to start medical school perhaps from second year. Upon completing your degree program, you may well find actually that it's easier for you to be able to get into the highly competitive specialty of ophthalmology, because you've got this optometry background, and also you may be able to skip out some of the stages of the training as well, because of the your degree in optometry and the knowledge that you already have. So that's something to think about if you're somebody who has your heart set on that. I know people who have been on the optometry training program, qualified and gone on to do ophthalmology and are consultant ophthalmologists now. Now, I certainly recommend that you thoroughly do your research, asking the right questions of the right people before you go and dive in. I certainly wouldn't want anybody calling me up in 5 years' time telling me that I ruined their life. Role and scope of work. Now, optometry is a primary healthcare profession. Now, what does this mean? Well, it means it carries a huge amount of responsibility, and it can potentially be the difference between life and death for some people. Now, that might sound quite dramatic, but an example and a quick case in point is a story of a patient that I saw last year sometime. This young girl was about 16 years old. She'd been getting quite dramatic headaches for the last 2 weeks, and literally every day. So instantly it didn't sound right to me in the first place. On examining the back of her eyes, there were some very early signs of swelling that was going on at the optic nerve at the back of the eyes. So instantly alarm bells rang for me, and I knew I had to get her referred and seen by the eye department straight away that day. So upon arranging that appointment and speaking with the consultant at the eye department, we agreed that she was going to come in, and upon her going in, within hours they had her admitted. She had to have fluid drain from her spinal cord, and it turned out that she had this buildup of pressure in her head, in her brain, which needed to be reduced straight away. And the scary thing for her was that the hospital advised her that if she had not come in even that day, it could have been a totally different outcome for her. And this is essentially what we mean by being a primary healthcare professional. It means that you have to have a broad enough training to be able to know what is normal and what is not normal, and a range of conditions and urgencies that they need to be referred and dealt with, so that you can be an effective person at screening and making sure that people are protected that come to you as patients. Optometrists examine for eye conditions and also are vigilant for other non-eye related conditions that may be visible through looking at the back of the eyes, and also along with the symptoms that people present that may be non-eye related things that you may be able to refer them to their family doctor about. Optometrists make diagnoses on the conditions that they manage, and they also make provisional diagnoses on the conditions that they refer to ophthalmologists or to family doctors and other healthcare professionals. Optometrists can manage a range of eye care conditions, and more specifically those that do not require medical treatment or surgical intervention. So optometrists have a limited prescribing rights, and this varies from country to country, perhaps from state to state, wherever you are in the world. However, some optometrists in the United Kingdom have extended prescribing rights, which means that they're able to prescribe a wider range of medications for the treatment of conditions with prescription only medications. Optometrists can use certain drugs for the purposes of making clinical diagnosis. So this includes the drops that dilate your pupils, drops that relax your focus, and also anesthetic drops as well that help us to further investigate certain conditions. Optometrists are able to fit and supply contact lenses as well as optical glasses and lenses with a prescription. Optometrists can manage a range of binocular vision problems. So these are a range of conditions that affect how your eyes align and line up straight. Usually though, most optometrists will probably refer patients on to the eye department to professionals that we call orthoptists. Now, optometrists may choose to specialize in some subspecialties such as sports vision therapy. I myself have qualifications in low vision and aging, co-management of cataract and ocular therapeutics. Now moving over to ophthalmologists. Now certainly in the UK, ophthalmologists mainly operate as secondary healthcare professionals, and this means that most of their patients come to them via referrals from optometrists, family doctors and other healthcare professionals. Now, ophthalmologists can of course operate as primary healthcare professionals as well, and this often happens though when they're not in the hospital setting, because most referrals from optometrists and family doctors are sent to a hospital. So if an ophthalmologist has a private clinic, then you usually find that patients that come to them directly, that may be a primary healthcare situation. Now, the work of an ophthalmologist is all about making diagnosis and making calls on surgical and medical treatments for the eyes. Now, certainly in the United Kingdom, ophthalmologists are the only ones that can certify a person legally blind or partially sighted. Ophthalmologists treat eye and whole body systemic and medical conditions with the use of prescription only medications. Now, ophthalmologists carry out eye surgery because it's a major part of their work. The exact type of surgery that they will do will depend on their chosen subspecialty. An ophthalmologist often specialize in 2 or 3 subspecialties such as vitreoretinal surgery, corneal surgery, or even glaucoma. Now, a lot of people don't know this, but the training of an ophthalmologist does include the ability to do refractions, which means that they're able to determine what glasses you need and to be able to issue a prescription for you to obtain glasses. Now, in terms of where they work, there is overlaps in this, but optometrists generally have a bit more freedom and options in terms of the different environments and the different scenarios in which they can work. So optometrists can work in the community setting, in a community practice. They can also work in the hospital environment. You get some optometrists who work as domiciliary optometrists. That means they go out to your home to do the eye examination, or they may go out to care homes and do eye examinations on the population of the care home. Optometrists also work in multidisciplinary practices where you have a mixture of healthcare professionals such as dentists, ophthalmologists, family doctors, etc. And then finally, optometrists often can work as well in vision science research and laboratory type environments. Now, for the most part, ophthalmologists can be found working in the hospital-based settings, but they can also work and do often work in private practices where they may run private glaucoma, private cataract clinics, and you may also find them in multidisciplinary medical practices, although this is generally less common. And then finally, there are a lot of ophthalmologists, of course, involved in medical research and vision science research. Now, some people might argue that we really don't need both of these eye care professionals, and in fact, in the past, there have been a little bit of a friction between the two. because of some of these overlaps. Now, however, with time, greater understanding has developed between the two eye care professionals, which only really makes sense when we think about the fact that we've got a hugely aging population around the world with really significant eye care conditions on the rise, and only a small number of ophthalmologists and a relatively small amount of optometrists really tasked with trying to serve this population. So the two have really learned to work hand in hand in a cooperative way, with optometrists really being able to screen out and filter out only the really essential medical and surgical cases that need to be referred to the ophthalmologist, and then the ophthalmologist in turn being able to focus on really these essential medical needs and surgical needs that only they are capable of doing. Now, it's also worth mentioning that there are other eye care professionals that are part of the wider eye care team, and this includes the dispensing optician, also known as an optician in other parts of the world. In the UK we call them dispensing opticians, and they have their own qualifications and are registered as well. And then we have orthoptists as well. Orthoptists mainly work in hospital settings and dealing with binocular vision problems, and dealing with childcare binocular vision and coordination problems. And these two eye care professions often don't receive the recognition that their work demands, but they are certainly valuable members of the wider eye care team, and that's perhaps a subject for another video. Now, leave me a comment in the comment section below. Let me know what your thoughts are on the difference between the optometrist versus ophthalmologist, and if that has caused you confusion in the past as well. So thank you for watching, and I look forward to seeing you in the next video. Take care.